Good morning, good afternoon, good evening, good wherever you are. Welcome again to Mizan Coaching. I'm Dr. Mizan. If you're new to this channel, I am a family medicine trained medical legal consulting physician. So that basically means that I travel the US. I've also worked in Asia and Europe, and I basically help everyone with medical legal advice. So I help attorneys, I help patients, I help hospitals, I help clinics. My contact information is in the profile if you want to contact me or my team. And really, the reason why I do this is basically to increase justice in the healthcare world. Please watch our previous videos. We talk about how private equity is basically swallowing up hospital systems, clinic systems all across the US and starting in Canada as well. Um, but basically, my role is really just to educate fellow physicians, hospitals, clinics, but also patients on what should they expect when going into a hospital? What should they expect when seeing their PCP? So without further ado, I'm very happy to announce the start of our brand new series, Famous Medical Malpractice Cases Throughout US History. And during our research, we were astounded by just how many medical malpractice cases were and are in the public eye, and we just don't really think of them as medical malpractice. We just think, oh, they're it's just some lawsuit that occurred. And of course, one of the most famous ones was the case of Michael Jackson and how he died or was murdered or whatever, unalived. I guess we have to say that on YouTube now, right? So to start off this series, we're going to go through in my opinion, what I think is one of the most famous medical malpractice cases. And the reason why I think that, and again, this is just my own personal opinion, is because the Libby Zion case really fundamentally changed medical training forever. Like, meaning medical training prior to this was a totally different animal than what it was after the conclusion of this case. So, without further ado, let's dive into this. And if you do have any comments, please like, share, subscribe. We're still a brand new YouTube channel, but the information that we're providing is absolutely free, and we don't care at all about monetization or whatever. Like, we're extremely happy and content with our lives, but we really do want to share this information because it's so niche, and I do feel that I want to share this information with the world. Okay, so the Libby Zion case. So who was Libby Zion? So Libby Zion was a freshman at Bennington College in Bennington, Vermont. And all of these will link in the description below. Please read everything yourself. Don't trust me, don't trust anyone, right? Anyway, so Libby Zion was an 18-year-old female freshman at Bennington College in Bennington, Vermont. She took a prescribed MAOI antidepressant that basically stands for a monoamine oxidase inhibitor, and it's just a form of antidepressant. Today we usually use SSRIs, but back just 20, 30 years ago, there were different classes of antidepressants. So she took a Maui antidepressant. She took phenelzine daily. A hospital autopsy revealed traces of cocaine in her system, but other later tests showed no traces. So this was actually what led to the ultimate conclusion of the case. But we'll get into that in a bit. The patient was the daughter of Sidney Zion, a lawyer who had been a writer for the New York Times. Her obituary in the New York Times, written the day after her death, stated that she had been ill with a, quote, flu-like ailment for the past several days. The article stated that after being admitted to New York Hospital, she died of cardiac arrest, the cause of which was not known. And to this day, in 2024, we have a hypothesis as to how she passed away, but we really don't know. Like, there wasn't a full chemical autopsy done. And if it was, there was a lot of controversy as to what actually led to her death. Okay, so Libby Zion had been admitted to the hospital through the emergency room by the resident physician assigned to the ER on the night of March 4. Raymond Sherman, the Zion family physician, meaning the PCP, agreed with their plan to hydrate and observe her. Zion was assigned to two resident physicians, who both evaluated her. There was an intern or a first-year resident physician and a second-year who's basically the intern senior. They were unable to determine the cause of Libby's illness. However, the second year tentatively suggested that her condition might be a simple overreaction to a normal illness. After consulting with Dr. Sherman, the PCP, the two prescribed pethidine, which is meperidine, to control the strange jerking motions that Zion had been exhibiting when she was admitted. The two residents were both responsible for covering dozens of other patients. After evaluating Zion, they left. One of them went to cover other patients, the other went to sleep in an on-call room in an adjacent building. The patient, however, did not improve and continued to become more agitated. After being contacted by nurses by phone, one of the residents ordered medical restraints to be placed on Zion. Fun tip, or rather, interesting tidbit here. As of today, we highly do not order restraints, and we just don't. Like, there are very few medical justifications or indications to order physical restraints, and they're called 4-point restraints because, four extremities, but there's only a few. Like, if a person is a danger to self, danger to others, but all across the board across the US, like, we really don't use restraints anymore. Back even, like, just a few years before I was in residency, during my parents' time, they restraints were a normal thing. And a lot of you people who are, in your 40s or 50s or later, you probably were restrained in the hospital. And leave a comment below if you were. And how do you feel about that? Like, do you feel like it was draconian? Do you feel that it was, like, insane? Because, like, for me, like, during my medical training, when I heard about this, I was like, that's insane. Like, why would you restrain a patient? Um, Things change, right? Okay. So she was ordered medical restraints. She was also prescribed haloperidol, which is called Haldol, by phone to control the agitation. The patient finally managed to fall asleep, but by 6:30 in the morning, or rather by 6:30, her temperature had soared to 107 degrees Fahrenheit, which is 42 degrees Celsius. The resident was once again called, and measures were quickly taken to try to reduce her temperature, but the patient had a cardiac arrest and could not be resuscitated, and she died. Several years later, physicians concluded the combination of phenelzine and the pethidine given to her by the residents contributed to the development of serotonin syndrome, which led to increased agitation. This led to the patient to pull on her IV catheter, which caused one of the residents to order the physical restraints, which the patient also fought against. By the time she finally fell asleep, her fever had already reached dangerous levels, and she died soon after of cardiac arrest. Why is this important? So firstly, to go back to bookend what I stated initially, the reason why this case was a lot more complicated than expected was because not only were the residents, okay, so firstly, nothing in medicine is black and white, and that's something that we all have to be aware of. Like, there's no such thing as a 100% positive or negative case in the world of medical malpractice. That's not a thing. So there's always nuances. There's plaintiff arguments, there's defense arguments. And so in this situation, the plaintiff argument was that, look, like, these physicians, like, they are physicians, and watch my videos that I've posted months ago. Yes, resident physicians can get sued, and they do very often. So this myth that, like, if you're a resident in training physician, you can't get sued because it's under your attending's license, completely false. And it's something that a lot of even program directors keep perpetuating. So if you're in medical training, if you're a resident and attending, a program director, please stop spreading this misinformation, because it gives residents a sort of sense of, like, oh, there's a safety net, I can do whatever I want. But no, there has to be accountability, and even if you're in training, even if you're an intern. Okay. So not only was there, this not only was there poor patient care because the physicians were calling in orders, they weren't going and seeing the patient physically. They were giving Haldol, which is an agitation medication. It's called an anxiolytic, without putting eyes on the patient at that moment. So that's a huge red flag. Like, whenever you get called in by a nurse, I know it sucks, I know it's the nighttime, but you need to go and lay eyes on the patient, do a physical exam. Because at the end of the day, the doctors are the ones who are running the show, right? That's really what it is. Okay, number two, she was put on restraints. Like back then, I can't attest to the 1980s, but it was a different world. I don't really have an opinion there. I think it's strange. Number three, the reason why this was such a complicated case was because they indeed found cocaine in the patient's system. So there's very little information about this because HIPAA, right? There's confidentiality rules. But basically, because of that, it wasn't a full slam dunk case. Like it was there was a percentage of fault given to the hospital and there was a percentage of fault given to the patient herself. Very typical of medical malpractice. And it's used for the calculations for settlement and damages, etc. Okay, so what ended up happening? Why did this change healthcare? The reason why is because after this happened in the 1980s, um, the New York State, so New York basically created what's called the Libby Zion Law in 1989. And so basically, residents have something called the ACGME, which is their accreditation board, and it's sort of like the body that oversees all residency programs. So after about 20 years, I'm terrible at math, but it took about 2 decades from the moment of this incident to the ACGME actually putting legitimate work week laws and limits for residency training. So as of 2003, the work week is now less than or equal to 80 hours, but averaged over 4 weeks. So a lot of residents, they just work stretches of 1 week, 2 weeks. But as long as you work less than 80 hours, which, fun fact, very few of them actually work less than 80 hours, and a lot of programs are basically doing illegal work with their residents. And please, program directors all across America, please change this because it's not making better doctors. It's making more burnt out doctors. Number two, less than or equal to one on-call night every 3 days, a 30-hour max shift. So just one generation ago, people were working 3 days straight. That was called a 72-hour on-call day. Legitimately, that's what training consisted of. 10-hour between shifts. So you need to sleep at least 8 hours, right? Routinely flouted, does not apply to fellows. And the controversy is that they say it reduces medical hours. However, but doctors also need medical training. They need necessary time for medical training. So the answer to all of this is sort of in my video on private equity, but we just need more doctors. We need to stop treating hospitals like they're businesses. Like we need to hire more doctors, more nurses. We need to lower the amount of patients that doctors and nurses are responsible for. And we need to know that, once this occurs, everyone will be happier. Patients will be happier, doctors will be happier, nurses will be happier. But yeah, so that was the Libby Zion case. It literally changed the it changed healthcare, it changed training, it changed everything for the better, in my opinion. But again, it should be better in my, like, really, because ever since I left clinical medicine, now that I look back, we were indentured slaves, and it's still how it is in America and all across the world, actually. Anyway, I hope you guys liked this video. It's the first of our series. If you have any famous medical malpractice case ideas, please leave a comment below. We have a few in the pipeline, most famously, who was it? Mary Poppins. I forgot her name, but Mary Poppins, Michael Jackson. So we'll be covering quite a few celebrities and also some just historically famous med mal cases. But yeah, thank you guys for watching, and we just broke 100 subscribers, so thank you so much, everyone. We really, really do appreciate all the comments and all the views. And the comments are amazing. Like, you guys are actually watching our videos, which is great. So thank you. This is really a dream come true for us to just spread this knowledge. But yeah, thank you again, guys, and until next time.